Hello everyone, welcome to Orthopaedic Essentials. In this video, we will learn about Thomas Splint and other fixed traction methods. Now, one should know that Thomas Splint and Bohler Braun splints are the two most important splints that everybody should know almost everything about it. And in this video, I will be discussing the questions that are asked in the related to Thomas Splint. What is Thomas Splint? What are the parts of the Thomas Splint? How is it made and how is it measured? And after that, how we give fixed traction with it. And the sliding traction part of the Thomas Splint will be discussed in later videos. What is Tobruk splint, and then what is pin plaster technique, all these things. Thomas Splint was first described by Sir Hugh Owen Thomas in the year 1876. He described it for basically subacute to chronic inflammation of knee joint. Thomas Splint was later popularized by Sir Robert Jones in the year 1916 onwards in First World War. Thomas Splint consists of a ring, an inner bar, and an outer bar, and a joint at the end. Right now, the inner bar forms 120-degree angle with the plane of ring. The outer bar is curved outwards from around 5 centimeter from the ring to clear the greater trochanter prominence. Now, how the measurements are taken? Now, this one is very much important. Now, for ring of the Thomas Splint, we take oblique circumference, which is immediately below the gluteal fold and ischial tuberosity. We measure a oblique circumference. Now, if we are measuring the circumference in normal limb, and if there is swelling in the affected limb, then only we will add 2 inches to the circumference of the ring of the Thomas Splint. Otherwise, we will not add 2 inches. If there is no swelling in the affected limb, in the region of the groin where we have to fit the Thomas Splint, then we will not add 2 inch. Alright. 2 inch is only to accommodate the swelling. If there is no swelling, there is no need to add 2 inch to the circumference. Why? Because we want the ring to fit snugly to the root of the limb. So if anybody asks why do we add 2 inch, so we have to tell that we will add 2 inch only if we are measuring the circumference in the normal side and there is swelling in the affected side, only then we will add 2 inch to the circumference. Right? Length. Now length is taken from the crotch to heel and we will add 6 to 9 inches to that. So we know the measurement of ring, we know the measurement of inner bar, and we know that the outer bar will be around 5 curved outward around 5 centimeter from the ring, and they will make a Thomas Splint. Alright. Now, second question they ask is, how do you prepare a Thomas Splint? How do you prepare a Thomas Splint? And at some centers, even they will provide you with Gamgee pad, cotton rolls and bandages, and tell you to demonstrate how do you prepare a Thomas Splint. Now this diagram has been taken from Stewart's, and you should see that after padding of the ring, a sling is taken from the ring. It is first fixed to the ring and then it is passed over the outer bar, and from the outer bar it is taken to inner bar, and this is fixed this way, so that we can minimize this gap. When we take the sling from the ring to the outer bar, in that case we will leave a very small amount of spaces, right? That's why you have to show that you know this, that when we measure the when we apply the sling, the first sling is after padding. The first sling has to be taken from the ring to the outer bar and then to the inner bar, and then it is pinned. All right. Now for subsequent splints, what we do is, suppose this is a Thomas Splint. Now we will take 6 inches bandages. All right, 6 inches bandages of adequate width. All right, 6 inches bandages of adequate width. And how do we wrap it? So suppose this is inner bar and this one is outer bar. This is inner bar and this is inner bar and this is outer bar, right? We are having an end on view. This is inner bar, this is outer. Now how the sling is wrapped? So in this case, first we will loop around the inner bar, then both the slings will come both the sides of the sling will come together. Then we will turn it around the outer bar after stretching it or tightening it, and then we will fix it with a pin. This you can see here is a pin. All right, in this way we will use slings to prepare the bar. How far? Now another question which can be asked is, can we use Thomas Splint to bear weight? Can we use it as orthosis? The answer is yes, but the problem is that it offloads only 50% of the weight through ischial tuberosity. Alright, rest of the 50% is borne by the femur or the hip.